Wednesday, Medical Monday. Mother's Day is this Sunday. And for our next guest, the support of her mom throughout her medical journey helped her finally uncover the underlying cause of her chronic symptoms. And here to explain, please welcome back the founder and CEO of Hotze Health and Wellness Center, Dr. Stephen Hotze, along with patient Kara and her mom, Ida Lynn. Good morning.
Good morning. Thank you,
All right. Kara, with you, life was kind of a struggle from the get-go. What was your childhood even like?
I was very sick all the time, some kind of illness. It really got worse after I got out of high school. I found out I had Crohn's disease and went off to college, got incredibly sick, had to drop out of college, come back home, and it's just been a nightmare.
Yeah. And
Remember, Crohn's disease, for those people that don't know, it's inflammatory bowel disease.
So, and Ida, you know, she was had a life of antibiotics to try to address all these things.
All the time. Anytime you go to the doctor, you got antibiotics. So
yeah.
she always...
As a child, she was taking antibiotics a lot.
A lot.
Okay, we had mentioned this at the top of the show about the fact that we give antibiotics so freely, and it really has an adverse effect. So, Dr. Hotze, let's go through the car, because you start spinning out of control, and then the fatigue and the joint pain, and then life for you, you were just numb.
Well, so you had Crohn's disease. What did they? How many doctors did you see?
At least 5.
For the Crohn's.
For the
Crohn's
and
alone.
in total, altogether, how many doctors?
Probably 12, 13.
From 2009?
Yes, sir.
Okay.
So what we saw here, Dr. Hotze, is that doctors had a tendency to treat symptoms, which treating it with antibiotic, treating it with steroids, treating with... So, as you always say, if you don't get to the underlying
If you don't treat
cause,
the underlying
you're
cause,
not fixing anything.
all those drugs were masking the symptoms, and then they operated on you, huh?
Right. 3 times.
3 different surgeries for the Crohn's disease. And then what did they do for the pain management?
Lots and lots of pain medicine. I was taking heavy-duty pain medicine for 3 months.
And
What
again,
type?
not
What
looking at the
type?
source of the pain.
I was taking Oxycontin and fentanyl patches for 3 months.
Highly addictive medications.
Extremely.
Yeah,
I couldn't get out of bed.
All right.
And so then
then
something interesting happens. You end up getting married. You have some, with Crohn's disease, you get some relapses, and then you have some remissions. So during remission, you felt well, ended up getting married.
Yep, but got married, and about a year later, I had migraines. Was in the hospital for migraines. That medicine made me feel like I was losing my mind. I felt crazy.
Antidepressants.
Yeah, but what really happened that was interesting, Dr. Hotze, is Mama saw a particular TV show. What was that show?
I think it was your show.
Yeah, you don't think it was. You know it was. It was great to And then, you know, because we oftentimes talk about people who have come with all these different symptoms, and they're giving, you know, medications and drugs to try and address them, but not the underlying issue. So, at the end of the day, when you came in, that's one of the things that you do at your center, Dr.
I know. Listen, this is what we do, but listen to this. She ends up getting pregnant, and tell us about your pregnancy.
I was getting there.
Listen, I know. We worked together a long time. Okay. Well, you want a doctor. You want a doctor all the time anyway. You be the doctor. Well, then, Dr. Duncan, then what did you do?
Yes. Well, then what happened was she got pregnant. And as I did, I had the hypothyroidism, but no one would tell me what it was. They kept saying, well, you're old and had a baby, or you just had a baby, that just happens. And so then you're exhausted, aren't you?
Oh, but while I was pregnant, I felt amazing. I felt...
Progesterone.
Yes. Felt so well. And so that got Mom and I thinking, something's got to be going on, while I felt so wonderful while I was pregnant.
Yeah, because your body's in overdrive on those hormones, right?
And so that brought us to the Hotze Center.
All right. So because
And
your
you
mom saw
came
the show.
when? November 2014.
Yes. Yes.
So about 6 months ago.
Yes.
Yeah. All right, so let's talk about this, because a couple of things that you did here. One is dealing with the Crohn's disease. Because she was on all those antibiotics as a child, it just kind of wrecked her digestive system.
What that does is it kills normal, healthy bacteria. You get overgrowth of yeast, and it's very common. You get inflammatory bowel disease. So she came in and saw Dr. Ellsworth at our center. Of course, he immediately put her on a yeast-free eating program, right?
Yes.
And he put her on some natural progesterone, because that's the hormone that's in pregnancy. It promotes gestation. That's why you felt so well. And then they put you on a little thyroid as well. So...
What's life like now today?
Amazing.
Yeah,
I wake up every day, and I just feel like a new person has been born. I just am so thankful.
With that said, I got to tell you, Dr. Hotze, people ask me all the time and go, so did that really work for you? And I'm telling you, yes, it really worked for me. It gave me my life back, too. Literally gave me my life back. But then they asked me, does he take insurance? And I said, you know what? This is the best dollar I have ever spent in my life because I got my life back. What's your life worth? There's a reason why you don't take insurance.
You saw 12 doctors and they took insurance, right?
Yeah.
And so there you were.
Yes.
So why don't you go somewhere where they know what they're doing? See, insurance won't pay for normal approaches to health. They want you to be on all these drugs.
They would pay for my 5 medications to address my symptoms, but they wouldn't pay for my bioidentical thyroid.
Right.
There's no
And
telling
we
how much they
hospital.
spent on her
$40
health
for my bioidentical thyroid. They wouldn't pay for that. I gladly pay for it, but they would pay like $800 a month for the Adderall and the antidepressant and everything else. So anyway, point made. And you can join Dr. Hotze this Wednesday, May 6th, from 6 to 7 p.m. at the Hotze Health and Wellness Center for an open house. For more information and to make an appointment, call 888-473-5531. 888-473-5531. It's a great place for you to ask all the questions. You can visit hwc.com as well. Thank you very much.
Thank you all. God bless you.
And I'll